Good afternoon, everyone. Thank you for joining us today. My name is Mike Montez, and I'm one of several personal benefit consultants here at Medigap Advisors, and I'll be your host today. My colleague, Mr. Tom Lockwood, will also be joining me today to discuss the ins and outs of prescription drug plans and how to maximize your benefits. Today's presentation will be focused on the topic of Medicare Part D prescription drug plans, and we're going to do our very best to make this confusing subject as easy to understand as possible. Our next webinar, you'll learn all about the ways in which you can take advantage of our upcoming open enrollment period, so stay tuned for an email about that, or visit our website to register for that session. It'll take us approximately 20 to 25 minutes to go through the basics of what Medicare prescription drug coverage is all about and how it works. And if you stick with us until the end, you'll know more about Part D than the other 99% of Medicare beneficiaries out there, and more importantly, you'll learn how to get the most value out of your drug plan year after year with our help. Although it may not seem like it, the information we'll cover today can potentially end up saving you thousands and even tens of thousands of dollars during your lifetime. So to avoid any distractions, we're going to go ahead and mute the phone lines. At the end of the presentation, we'll take some questions, and you can also use the chat box to type in your questions as you think of them. And due to the strict guidelines that Medicare has, this webinar is intended for educational purposes only, so we won't be able to address anyone's plan-specific questions or how one company's drug plan works compared to another. However, we will give you some exact instructions on how you can go about getting those specific types of questions answered if you do have any at the end of our session. And lastly, I wanted to note that Medigap Advisors is not affiliated or endorsed by CMS, Medicare, or any other federal or state agency or organization. So with that said, Tom, what can you tell us about prescription drug plans?
So thanks, Mike. Let's start with a quick overview of the four parts of Medicare. Medicare covers many types of services, and you have options for how you get your Medicare coverage. Medicare has four parts. Part A is hospital insurance, helps pay for inpatient hospital stays, skilled nursing facility care, home health care, and hospice care. Part B, medical insurance, helps cover medically necessary services like doctor visits and outpatient care. Part B also covers many preventive services, including screening tests and shots, diagnostic tests, some therapies, and durable medical equipment like wheelchairs and walkers. Part C, Medicare Advantage, is another way to get your Medicare benefits. It combines Part A and B, and sometimes Part D, Medicare prescription drug coverage. Medicare Advantage plans like HMOs and PPOs are managed by private insurance companies approved by Medicare. These plans must cover medically necessary services. However, plans can charge different copayments, coinsurance, or deductibles for these services. Part D, Medicare prescription drug coverage, helps pay for outpatient prescription drugs and may help lower your prescription drug costs and protect against higher costs in the future. Today's webinar will be focused on Part D, this particular aspect of Medicare, so let's go get started. Medicare prescription drug coverage adds to your Medicare health care coverage. It helps you pay for medically necessary brand name and generic prescription drugs. Medicare drug plans are offered by insurance companies and other private companies approved by Medicare. All people with Medicare are eligible to enroll in a Medicare drug plan. To get coverage, you must join a plan. Enrollment is not automatic. There are two main ways to get Medicare prescription drug coverage. You can join a Medicare prescription drug plan, standalone plan. These plans add coverage to original Medicare and may be added to some other types of Medicare plans, but not Medicare Advantage plans. Or you can join a Medicare Advantage plan with a prescription drug coverage, also referred to as MAPD, like a health maintenance organization, HMO, or a preferred provider organization, PPO, or another Medicare plan that includes Medicare prescription drug coverage. You'll get all your Medicare coverage Part A and B, including prescription drug coverage Part D, through these plans. We'll use the term medical drug plan throughout this presentation to mean both PDPs and MAPDs. or other medical plans with prescription drug coverage. Some Medicare supplemental insurance Medigap policies offered a prescription drug coverage before January 1st, 2006. This isn't considered Medicare prescription drug coverage. Medicare plans may be different from each other in terms of which prescription drugs they cover, how much you have to pay, and which pharmacies you can use. Most plans offer an additional discount if you choose to fill your prescriptions through a preferred network pharmacy. All Medicare drug plans must give at least a standard level of coverage set by Medicare. However, plans offer different combinations of coverage and cost sharing. Plans may offer more coverage and additional drugs, generally for a higher monthly premium. Most plans offer different benefit structures, including tiers, co-payments, and/or deductibles. Enhanced plans may offer additional benefits like coverage during the coverage gap or coverage for drugs that Medicare Part D doesn't traditionally cover. Plan benefits and costs may change each year, so it's important to look at and compare your plan options annually. A little later, I'll describe exactly how you can press the easy button and have us do everything for you. Your cost for prescription drug plans will depend on the plan you choose and some other factors such as which drugs you use, which Medicare drug plan you join, whether you go to a pharmacy in your plan's network, and whether you get extra help paying for your drug costs. Most people will pay a monthly premium for Medicare prescription drug coverage. You'll also pay a share of your prescription cost, including a deductible, co-payment, or co-insurance. Once you and your plan have paid $4,850 in covered retail drug costs in 2016, you leave the coverage gap and pay 5% or a small co-payment for each drug for the rest of the year. Here's an example showing what you'd pay each year in a standard Medicare drug plan. Very few plans actually follow this design. Your drug plan costs will vary. Monthly premium, most drug plans charge a monthly fee that differs from plan to plan. You pay this in addition to the Part B premium, if you have Part B. If you belong to a Medicare Advantage plan, like a health maintenance organization, or a preferred provider organization. That includes drug coverage, the monthly plan premium, and may include an amount for prescription drug coverage. Yearly deductible. You'll pay up to $360 in 2016. This is the amount you pay each year for your prescriptions before your plan begins to pay. No Medicare drug plan may have a deductible greater than $320 in 2015, and it's $360 for 2016. And some plans don't have a deductible at all, so it's up to the plan to decide whether they're going to have no deductible or all the way to a max of $360. Co-payments or co-insurance. These are the amounts you pay for your covered prescriptions after you pay the deductible, if the plan has one. You pay your share, and the drug plan pays its share for covered drugs. The coverage gap begins after you and your plan have spent a certain amount of money for covered drugs, $3,310 in 2016. Once you enter the coverage gap, you pay 45% of the plan's cost for your covered brand name drugs and 58% of the plan's cost for covered generic drugs until you reach the end of the coverage gap. So an example there would be a drug that has a retail price of $100. Your copay is $10. When you get to $3,310, that's when you start paying the 45% and 58%. But it's the combined cost of the retail price of the drug. It is the retail price of the drug is how it's calculated. So what you pay and what the plan pays, add them together, and that puts you closer to the coverage gap. Catastrophic coverage, once you reach your out-of-pocket limit, you leave the coverage gap and automatically get catastrophic coverage, where you only pay a small coinsurance, no more than 5%, or copayment for covered drugs for the rest of the year. Your coverage gap discount on drugs will increase each year until 2020, when you'll pay approximately 25% for all covered drugs in the gap. Next year, you'll pay 45% for brand name drugs in the coverage gap, unless you get extra help. Medicare drug plans, together with a manufacturer's 50% discount, pay for the remaining 55% of the costs. Medicare drug plans will pay an increasing amount of these costs until 2020. In 2016, you also pay 58% of the retail price for generic drugs in the coverage gap. A small group, less than 5% of all people with Medicare, may pay a higher monthly premium based on their income as reported on your IRS tax return from 2 years ago. If your income is above a certain limit, you will pay an extra amount in addition to your plan premium. Social Security uses income data from the IRS to figure out whether or not you have to pay a higher premium. The income limits are the same as those for the Part B income-related monthly adjustment amount, IRMAA. If you don't pay your entire Part B premium, including the extra amount, you may be disenrolled from your Medicare drug plan. You must pay both the extra amount and your plan's premium each month to keep Medicare prescription drug coverage. If you have to pay an extra amount and you disagree, for example, if you have a life event that lowers your income, contact Social Security. Each Medicare plan, drug plan, has a formulary, a list of prescription drugs that it covers. Each formulary must include a range of drugs in the prescribed categories and classes. To offer lower costs, many plans place drugs into different tiers, which cost different amounts. Each plan can form its tiers in different ways. Here's an example of how a plan might form its tiers. Tier 1, generic drugs, the least expensive. In some cases, there may not be a generic drug available for the brand name drugs you take. Tier 2, preferred brand name drugs. Tier 2 drugs cost more than Tier 1 drugs. Tier 3, non-preferred brand name drugs. Tier 3 drugs cost more than Tier 2 drugs. And specialty tiers where these drugs are unique and have a high cost. To join a Medicare drug plan, you must have Medicare Part A and or Part B. To join a Medicare Advantage plan with prescription drug coverage, you must have both Medicare Part A and Part B. Each plan has its own service area, and you must live in a plan's service area to enroll. If you live outside the United States and its territories, or if you're incarcerated, you're not eligible to enroll in a plan and therefore can't get Part D coverage. Medicare drug coverage isn't automatic. Most people must join a Medicare drug plan to get coverage. So while all people with Medicare can have this coverage, most must take action to get it. If you qualify for extra help to pay for your prescription drugs, Medicare will enroll you in a Medicare prescription drug plan unless you decline coverage or join a plan yourself. You can only be a member of one Medicare drug plan at a time. When you first become eligible to get Medicare, you have a 7-month initial enrollment period, IEP, for Part D. You can apply 3 months before your month of Medicare eligibility, and coverage will start on the date you become eligible for Medicare. If you apply during your month of eligibility, then your Medicare drug coverage begins the first day of the following month. Or you can apply during the 3 months after your month of eligibility, with coverage beginning the first day of the month after the month you apply. Some groups of people who become eligible to get Medicare will be enrolled in a Medicare drug plan by the Centers for Medicare and Medicaid Services, unless they join a plan on their own. You can join, switch, or drop a Medicare drug plan during Medicare's open enrollment period, also known as the annual election period, or AEP, which is from October 15th through December 7th each year. The changes go into effect on January 1st of the following year, as long as the plan gets your request for enrollment by December 7th. Between January 1st and February 14th, you can leave a Medicare Advantage plan and switch to a regional Medicare. If you make this change, you may also join a Medicare drug plan to add drug coverage. Coverage starts the first day of the month after the plan gets the enrollment form. You can make changes to your Medicare prescription drug coverage when certain events happen in your life, such as if you move out of your plan's service area or if you lose other insurance coverage. These chances to make changes are called special enrollment periods, SEPs. Each SEP has different rules about when you can make changes and the type of changes you can make. These opportunities are in addition to the regular enrollment periods that happen each year. The SEPs listed here are examples. However, this doesn't include every situation. If you choose not to join a Medicare drug plan at your first opportunity, you may have to pay a higher monthly premium penalty if you enroll later. The late enrollment penalty is calculated by multiplying the 1% penalty rate times the national base beneficiary premium, which is $34.10 in 2016, times the number of full uncovered months you were eligible to join a Medicare plan but didn't, and went without other creditable prescription drug coverage. This penalty calculation is not based on the premium of the plan you were enrolled in. The final amount is rounded to the nearest 10 cents and added to your monthly premium. The national base premiums may go up each year, so the penalty amount you pay may also go up each year. You may have to pay this penalty for as long as you have a Medicare drug plan. Getting extra help means Medicare helps pay your Medicare prescription drug coverage monthly premium, any yearly deductibles, coinsurances, and copayments. If you have limited income and resources, you may get extra help paying for your Medicare prescription drug costs. Extra help is also called the low-income subsidy. If you have the lowest income and resources, you'll pay no premiums or deductible and have small or no copayments. If you have slightly higher income and resources, you'll have a reduced deductible and pay a little more out of pocket. If you qualify for extra help, you won't have a coverage gap or late enrollment penalty. You'll also have a continuous special enrollment period and can switch plans at any time, with a new plan going into effect the first day of the next month. Please see Appendix E for more information about the different levels of extra help, including the benefits and eligibility requirements for each level. Residents of U.S. territories aren't eligible for extra help. Each of the territories helps its own residents with Medicare drug costs. This help is generally for residents who qualify for and are enrolled in Medicaid. This assistance is not the same as extra help. There are several things to consider before joining a Medicare drug plan. The most important consideration in deciding if Medicare drug coverage is right for you is to look at the type of health insurance coverage you have currently and how that affects your choices. If you have prescription drug coverage, you need to find out whether it's creditable prescription drug coverage. Your current insurer or plan provider is required to notify you each year whether your coverage is creditable prescription drug coverage. If you haven't heard from them, call them or your benefits administrator to find out. Also, you may want to consider keeping your creditable prescription drug coverage rather than choosing a Medicare drug plan. It's important to find out how Medicare coverage affects your current health insurance plan to be sure you don't lose doctor or hospital coverage for yourself or your family members. If you have employer or union coverage, call your benefits administrator before you make any changes or sign up for any other coverage. If you drop your employer or union coverage, you may not be able to get it back. Also, you may not be able to drop your employer or union drug coverage without also dropping your employer union health coverage. If you drop coverage for yourself, you may also have to drop coverage for your spouse and dependents. Before choosing a Medicare drug plan, you may want to get your information together. You need information about any prescription drug coverage you may currently have, as well as a list of the prescription drugs and dosages you take. You'll also need the names of any pharmacy you prefer to use, your Medicare card, and your zip code. Finally, gather any notices you get from Medicare, Social Security, or your current Medicare plan about changes to your plan. Let us take care of all the heavy lifting by searching for drug and health plans for you. We can send you a personalized report with plans that meet your needs and allow you to compare your options based on quality ratings, benefits covered, costs, and more. In addition, we can facilitate your enrollment into the plan that's right for you. Obviously, you should compare Medicare drug plans based on what's important to your situation and your drug needs. So here are a few of the questions you may be asking yourself. Which plans cover the prescriptions I take? Which plans give me the best overall price on all of my prescriptions? What's the monthly premium, yearly deductible, and the coinsurance or copayments? Which plans allow me to use the pharmacy I want or get prescriptions through the mail? Which plans give me coverage in multiple states if I need it? What star ratings do the plans get? Can my coverage start when I want it to? Is it likely that I'll need protection against unexpected drug costs in the future? Since our objective at Medicare Advisors is to make it very easy for you, we can certainly help answer these questions and any other questions you may have about anything related to Medicare. So to recap, Medicare Part D provides your Medicare prescription drug coverage. You must take action to join a plan. We're here to help you every step of the way with this part of the process. A delay in joining may result in a late enrollment penalty. You have choices in how you get your coverage. Your personal benefits consultant can help you identify your coverage options. Extra help is available to people with low income and resources. Upon request, we can share more specific and detailed information about this and other programs and the steps you can take to qualify and apply. So back to you, Mike.
All right. Thanks, Tom, for that wonderful explanation on how to get the most from your prescription drug coverage. It's very valuable information that folks can continue to use for as long as they're on a drug plan. And as a reminder, the enrollment deadline will be here before you know it, and we urge you not to wait until the last minute. If you're not working yet with one of our friendly Medicare experts, we ask you to simply call the main line toll-free at 1-866-323-1441. It's down there on the screen as well. And you'll be routed to the licensed advisor that can assist you. From that point forward, you'll be able to communicate with your personal benefits consultant via email or phone whenever you have any questions at all about Medicare. And you can also schedule an appointment directly on their calendar for a day and time that's convenient for you. Because it's our busiest time of the year, a number of appointment slots have already been taken. So again, call the main line if you don't have a personal benefits consultant assigned to you at this point, or you just aren't sure who he or she is. If you are currently working with us already, then just reach out to your advisor directly by phone, email, or by adding yourself to the calendar. We'll answer any of your questions, guide you in the right direction, and help you determine the best course of action from there. Keep in mind that we represent all the top carriers and plans throughout the country, so we can help you find the plan that works best for you and your situation. And each year we'll continue and conduct an annual comprehensive policy review to ensure that you're always kept in the best and highest value, lowest premium plans available. Best of all, we can do everything from start to finish, and there's absolutely no cost to you whatsoever for our services. And that concludes today's presentation. We'll now go ahead and open up the line in case there are any questions out there. In the meantime, I'll show one of Tom's many excellent testimonials from a very satisfied client. If anybody has questions,
this is Rich in Massachusetts.
Hey, Rich. How are you doing?
How you doing? That was very good. Thank you. Now, as you're going through this, I made some notes in that, but I was thinking there's a lot of information there. It was too much to write down. Will we get a copy of what we just went through?
Yeah, absolutely. We will, I think, make the recording available, and it's going to also, of course, have the slides. We can also make the slides themselves, I guess, available for you, a downloaded copy or version of it if you would like. And
yeah.
Are you currently working with somebody right now in our...
Will Sheridan?
Okay. Hey.
Yeah, I get stuff from Will on a regular basis.
Okay, beautiful. Absolutely. Yeah, and
so
of course, if you have any more specific... Yeah, if you have any more, like, say, specific questions about your particular plan or program, or thinking about switching to another plan that might be better suited for you, anything that's specific, I guess, to a plan itself, you would have to address with Will. But any general questions, I'd be happy to answer for you here while we're on the webinar. So, yeah.
Most of these I'll cover with Will. I just did have one question, which is, I think, kind of general. You talked about a $360 deductible, and it had to be paid off. Now, I had to pay that this year on one of my prescriptions, but I didn't have to pay anything the previous year. Did this go up? Was there no deductible previously?
It depends on the plan. From year to year, what happens is they have an annual contract with Medicare, and you're able to make changes to your plans from year to year, but the plan design itself that we went through earlier was the general plan design that is structured under Medicare. Each particular plan does have the freedom of setting up their own plan design within those parameters. So the highest deductible
that's good.
Any plan was able to charge, was $320 this year. Next year it's $360, but in some cases they may not charge anything. To answer that question.
All right, that's good. So I have WellCare, so they have chosen to charge the say $320 this year, but they may not have done that previous year, is what you're saying.
Very possibly, yes. Mm-hmm.
So that's up to WellCare itself. Okay, thank you. That was all my questions. The rest I'll take up with Will and so forth. I keep hearing background noise. Is that me?
I'm not sure. I hear you clearly, so I'm not sure.
Okay, all right, that's fine. I think I'm all set on my questions, because the rest of this I'm sure I can cover with Will. So if anybody else has anything, I'm done.
Okay. Well, thank you very much for your question. I appreciate that. Anybody else on the line have any general questions that we can address here at the moment? Anything on the chat box real quick?
I guess that's it then, huh?
All right, sounds good. Yeah, so once again, we thank you all for taking the time to out of your schedule to join us today. We hope you got some value out of the presentation. I also wanted to remind you of our upcoming webinar that's going to focus on the open enrollment period, also called AEP, or the annual election period. We will send out information soon on how to join that session, and we hope to see you there. Until then, on behalf of Medigap Advisors, thanks again for listening, and have a great evening, everyone.
Thanks, Tom. Thanks, Mike.
Thank you. Thanks, everybody.
Bye.